No matter how sophisticated modern medicine might be, much of the path to recovery and good health depends on human behavior. That's why Cincinnati Children's developed our division of behavioral medicine and psychology. The division's 64 psychologists and 19 research faculty strive to understand and build the connections between health and behavior.
One thing that we know is behavior is a very basic component of almost any health condition and is related to many of them, such as obesity, diabetes. Our adherence center, you have to take the medication, that's a behavior. You have to follow through with your physical therapy. So all of those things have an underlying, how do we get people to change their behavior?
Finding the answers to this important question has made our division of behavioral medicine one of the largest of its kind in the country.
So in fact, we've grown to 64 over the years because every new clinical program or research program that evolves, our colleagues reach out and say they'd like psychology to be a part of that.
Our behavioral psychologists help teenagers considering weight loss surgery to prepare for changes in their eating and lifestyle habits. After the surgery, our staff work closely with the teens to make sure they continue to stay healthy. In studies of children who suffer chronic migraines, our behavioral medicine experts have learned that using relaxation techniques like biofeedback in combination with medications is far more effective at controlling headaches than using medication alone. Faculty in our Center for Adherence Promotion and Self-Management work to find innovative ways to encourage young people with chronic illnesses to take their medications.
And we've learned that large numbers, of upwards of 50% of children do not adhere. And so that discrepancy can be quite significant and contribute to things like losing transplants and rehospitalization. So it's a very costly problem that everyone's concerned about, including families.
One of the other things that I think makes us unique in the country among departments of psychology or behavioral medicine is the amount of funding that we've secured. In fiscal year 12, we had a total of $10 million from NIH grants. That's both direct and indirect costs. And that ranked us second in the institution across all divisions in NIH grants.
And these studies show that patients do better when behavioral intervention is part of their treatment.
The other thing that we do is translate research into clinical care at a very rapid rate. And we use that as part of our treatment and show patients how they're getting better, and we have a very high success rate. So it's not just that people feel better, we actually have the data to show that we make them better.